This will help you both understand and memorize your cardiac A&P in less than an hour. I'll even share my personal memory hooks for keeping all the valve names straight because I used to get those mixed up too. I created this diagram back when I was in nursing school, and I still use it every single week when I tutor nursing students today. Because once you understand how the heart normally works, then the rest of cardiac, like heart failure, blood pressure, and even EKGs, becomes shockingly simpler. Real quick before I forget to tell you, make sure to drop cardiac, CARDIAC, into the comments, and I will send you a link to get my cardiac diagram absolutely for free. All you've got to do is put cardiac in the comments so I know that you want it. The first thing you notice about this cardiac diagram is it's obviously not anatomically correct, but it is conceptually correct. I always say when you're studying anatomy and physiology, pretend like you're Miss Frizzle. Tell me in the comments if you know who Miss Frizzle is, okay? But you have to pretend like you have shrunk down a school bus full of fourth graders and you are taking them on the back of a red blood cell on a guided tour through the heart. If you can do that, if you can name all of the landmarks, you know their names, you know what's going on in each section, then that is a pretty good mastery of cardiac. That's going to help you get through med-surg and basically any time you have to study cardiac disorders. The first thing is we are entering the heart from the vena cava. Now, this is a vein and it's coming from the body. But this is where the blood flow returns to the heart. Now, for later on when you need to study things like heart failure and so on, you're going to want to know roughly where did the blood come from immediately before the vena cava, because that will help you understand symptoms later. But for now, we know it comes from the body into the vena cava. It goes into the right atrium, abbreviated as RA. So we're in the right atrium chamber. Now, we do notice that the heart is a mirror image of itself. So the right atrium's over here. The left atrium is going to be on the other side, and we'll see the same on the ventricles. But on this side, we can only access the right side of the heart. So we're in the right atrium. Now we're going through the tricuspid valve. Why do you think it's called the tricuspid valve? Always look at root words. That's going to help you so much in nursing school because I'm going to let you in on a little secret. We are not creative with our naming conventions in medicine, okay? So when we name things, we often name them very obvious things that if you just know what the root words or what the words mean, you can figure out what a disease is or helps you remember what the name is for. So tricuspid obviously has the root word tri. And tri is exactly what you think. It means three. So like tricycle, right? So this is called the tricuspid valve because it has three flaps. Three flaps right there, okay? And so when it is opening and closing to let blood through, there's three flaps that have to seal to close it up. And we're going to come back to that because I'm going to show you how to remember which side is tricuspid and which side is mitral valve later. But once it goes through the tricuspid valve, we get into the right ventricle. The right ventricle is the chamber of the heart that is going to be pushing the blood out of the heart. And it pushes it out of the heart through the pulmonary valve. And it makes sense. You can remember this because guess where the blood is going after the heart? We see the root word pulmonary. And pulmonary has to do with the lungs. And the right ventricle is pushing the blood out of the heart to go to the lungs. And it goes there through the pulmonary artery. Now, here's an interesting fun fact that you can ask at parties. What is the definition of an artery? Now, if I asked you before today, it's possible you might have said that the definition of an artery is a blood vessel that carries oxygenated blood. But that is not actually true. That's what most people believe when they're not in the medical field. But what the definition of an artery actually is it's something that carries blood away from the heart. So you got to think about arteries away. This will help you because typically arteries do carry oxygenated blood away from the heart, but there is one exception in the body, and that exception is right here. It's the pulmonary artery because we still have deoxygenated blood because where does the blood get oxygenated at? It gets oxygenated in the lungs. And therefore, we haven't been there yet. This blood is still deoxygenated, so it is leaving the heart and going to the lungs. And that is why it is an artery because it's the pulmonary artery is going away from the heart. Now, once it gets into the lungs, we use the process of diffusion to oxygenate the blood in the alveoli. If you want me to do a separate video on that, let me know. I always say if I get at least 10 people asking for it, then I will do it. because that is a really important feature, physiological fact to understand a lot of the respiratory disorders. But let's just say all the blood got oxygenated and now it's coming back into the heart through the pulmonary vein. So same question as the artery, but what is the definition of a vein? The definition of a vein is not carrying deoxygenated blood, as you can see from the red blood coming through the pulmonary vein. It is that it carries blood back to the heart. So you can see the vena cava here is a vein carrying the blood back to the heart. And the pulmonary vein here is a blood vessel carrying the blood back to the heart. Of course, now it's carrying it back from the lungs because pulmonary tells you where it's coming from. And in this case, it is oxygenated because it's freshly oxygenated from the lungs. Now, from here, it goes into the left atrium, our LA, which is our mirror of the right atrium, and it's going through the mitral valve. So here's the thing with the mitral valve. The mitral valve actually has two names that we call it. The mitral valve is one name. The bicuspid valve is the other, the bicuspid valve. And if you look at the root word for cuspid, you can quickly see that just like we have tricuspid over here, bicuspid is a root word that means two, and it tells us how many flaps are on this valve. So the left side of the heart has two flaps on the mitral valve, just like it has two names, a bicuspid valve and mitral valve. So the bicuspid valve is the one with two names and two flaps. The tricuspid valve only has one name, but it has three flaps. Now, the way I always remember which side is which is because I think about my biceps, okay? Remember, my biceps have two muscles, right? So when I think about my biceps, the two flaps, the left side of the heart, you probably know this, is considered the stronger side of the heart because it has to push blood through the entire body, whereas the right side of the heart only has to push blood through the lungs and back to the heart again. So it doesn't have to go very far. But the left side of the heart pushes blood all the way down to your toes and back again. That's a lot farther. And it has to be strong. It has to have strong biceps in order to push blood that far. So I always remember that the bicuspid is like my biceps. We're flexing, we're pushing blood all the way around. It's stronger. It's on the left side of the heart. So I hope that helps you remember the valves too. I find that the pulmonary valve and the aortic valve are a lot easier to remember because we're not creative with our naming conventions. And so it tells us exactly where the blood is going. And that brings us to the left ventricle and the aortic valve, because once the blood gets through the mitral/bicuspid valve, the blood goes into the left ventricle and it squeezes past through the aortic valve and into the aorta. So the aortic valve is named for where that doorway opens to, which is the aorta. And the aorta, of course, takes the blood out to the rest of the body and it splits off from there. I hope this explanation has been helpful so far. Let me give you a few more tips on how to get this memorized, because I am not kidding when I say not knowing this diagram is the number one reason nursing students struggle understanding cardiac disease processes in nursing school. All you have to do is get a whiteboard, get a blank sheet of paper, and draw it. This is super easy to draw. That's how I started when I first created it, and then label it, and then compare it to this diagram and see how do you compare. Did you remember everything? Did you forget things? I've even thought about putting this on a t-shirt. Should I put this on a t-shirt? I'm wondering if teachers would even let you wear it on test day. Now, if you're ready for me to show you how to take this cardiac diagram and translate it into understanding heart failure super easy, then watch this next video and I will see you there.